Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Let's start out with some really good news for those of us with school-aged children. Today, teachers are in the process of getting vaccinations. Does that mean we've moved on to the next group below 65 and up?
Yes, we are. We will have all daycare and schools in our county vaccinated, at least those who want to take it. We'll have them all vaccinated by the end of the week. That is certainly the plan. We're still taking appointments for anyone 65 and up who may have missed. And we're moving right along. I did want to announce too that the second dose clinic for 75 and up who received their first dose January 12th through 14th at the iHotel, only that group, we are now taking second dose appointments. So people can call 531-4538 to speak to the scheduling team. So that's 531-4538. Only if you're 75 and older and received your first dose at the iHotel January 12th, 13th, or 14th.
So you can sign up online or call.
Correct. Yep.
Okay, my next question is about the numbers now in Champaign-Urbana. We have the students back. I don't know if that's created a spike, but can we go over the numbers of where we are in terms of hospitalizations and deaths and recoveries?
It has not created a spike, we're happy to say. We have a total right now of 609 active cases in isolation, 878 in quarantine. We currently have 27 Champaign residents who are hospitalized. That's still high. We have have had 109 deaths. Right now, our county positivity rate is 5%, and our regional positivity rate is 5.1%. So that's really good news. Currently, we have had 28,345 vaccinated in our county with the first dose and 4,356 vaccinated with the second dose. So we're very pleased with that. And that was as of yesterday. By the time we're done today, that number is going to jump a lot. For those interested, we put that on our Facebook, we put that on our website every day.
You mentioned vaccinations of teachers. In that group, are we also including manufacturing workers, and you mentioned daycare providers as well? Who else is in that group?
Okay, well, let me pick up my little paper here. We are going to open that up today. I have so many papers everywhere. So I don't know if we're opening it today or tomorrow, but we are definitely opening it up this week. So people will need to look online for this. We've already vaccinated a lot in the group, but as of this week, when we open it up the next time, it will probably take us a few weeks to do that. So we'll open it up, fill them up, open it up tomorrow, next week. It's all based on how much vaccine we get. But so that'll be food and agricultural workers. So that's people working in processing, in plants, veterinary health, livestock services, animal care, postal service workers, manufacturing workers. That's anyone in the industrial production of goods for distribution to resale, wholesale, or manufacturers, grocery stores, baggers, cashiers, stockers, pickup, and customer service. So not everyone working in the entire, grocery store chain or Target chain, but everybody working down front with the public. Public transit workers, flight crews, bus drivers, train conductors, taxi drivers, of course, Uber, paratransit drivers, in-person support, all the ride sharing services. So Uber, Lyft, whatever other ones popped up overnight when I was sleeping. And so that's who we're going to be focusing on. So you can see that's a ton of people. So it'll probably take us a couple of weeks to get those done. And we'll just keep doing it until the state moves us to 1C, and then we're in a whole nother ball game. So we can't wait.
So be patient. If you're not in that group either, you're going as fast as you can. As fast as vaccines come into the community, you're putting them in people's arms.
Absolutely. And, the more vaccines we get out there, the more we're going to get. So, we really want people to get scheduled if they're up and they're due, get in there and get scheduled for those so that we can keep moving along.
What would help this is more vaccines. And Johnson & Johnson has come out. The efficacy, though, is lower in a global trial. It's one shot. They say it's 85% effective against severe disease. Does that make you nervous about having more vaccines come on the market, but with less efficacy?
No, I want as many vaccines as we can get because, the two we have right now are really high efficacy rate, but we need more vaccines. So if it's going to be new ones being developed or processed to get out there production, we'll take them. Because how it works, of course, is the more people that are vaccinated, if you get around them, then it's not going to spread. So that just helps keep compressing the numbers down. But I have got to stress with people that as many vaccines as we've done so far, it's only about 2.5% of our county. We cannot stop doing what we have to do, which is the masking, the distancing, the hand washing. That has got to continue. It's still not safe yet. Even if you've been vaccinated, please continue to wear your mask. And we don't want people to get a false sense of security of, oh, I've been vaccinated, so things are back to normal. We're also concerned that just because things in the state are opening up, that people think it's safe to do that. And I'm just, again, reminding people that, it is not safe to do that. If you're inside with other people that aren't in your family that are, and when I say family, I mean household, but if you are inside with people that are not masked, it is not safe.
And other factors that we're going to weigh in here are the fact that we have new variants coming in. We heard about it first in South Africa, and then North Carolina. Has it moved closer to this community?
It has. We know as of today, and we'll be sending out a release about this soon, but we know for a fact, we've gotten the results back, that we do have the B117 variant in our community. That's the one from the UK. It's about anywhere from 50 to 70% more infectious. That means that you may have kind of gotten away with not getting it when you've been in some kind of precarious situations before, but now you may. So if it starts circulating, that's why we have got to double down on the masking and wearing the mask correctly. I am about over seeing people with the mask down under their nose. You cannot go out without seeing that. I don't understand that. And I do notice it's often men. I'm not sure what that's about, but they need to pull that up, pull the mask up. It's kind of like sometimes you see people with their pants hanging down a little low, same thing, pull them up, pull those masks up. But yeah, so the variant is out there, and there's a belief that you can only be vaccinated. There's a belief that you can only be infected once. We're seeing people who have been infected more than once. So again, we just have got to keep doing that to get out of this pandemic.
Can you also clarify, let's say I had the virus in October, I had the first dose of the vaccine in December, I had the second one in January. Can I still get infected with it even if I've been vaccinated and I've had the virus?
Well, I who knows? About the time I say no, then, somebody will be. The issue now is, will we have variants out here that we start seeing in the US that are going to evade the vaccine? So, we have to keep what we're doing. But the reason why we're telling people who have, let's say you've gotten both vaccines and you have immunity, that, you still want to wear the mask, because we don't know we know you have a high likelihood of not getting sick enough to be hospitalized or dying. We don't know yet if you can still get a mild case and then spread it to others. So, and they might not be vaccinated. So, keep the masks on when you're around others.
And even though teachers are being vaccinated as we speak,
Mm-hmm.
and they go back into the classrooms, people under 16, there are trials going on, but there's no proof if they can get it, if they get bad cases, if they're carriers. So is there a safe solution to send kids back to school with just teachers and school workers vaccinated?
Yeah, I mean, the thing with being in schools in general, it's just, like being in any other workplace. As long as you keep them, when you have the desks in the classroom, they need to be at least 6 feet apart. So you need enough space, and you need to figure out how to have enough space, whether you have to stagger the days or however you do it, move into a larger place, like a gym or something. But you have got to be able to keep the kids 6 feet apart, and they have to wear masks all the time. And that way, if somebody brings in a case, it will not cause an outbreak in the school.
Let's move to nursing homes for a second and long-term care facilities. There was some national uproar that CVS and Walgreens were not working effectively in order to get it out there. Here in our own community, which is really what you're focused on, how have the long-term care facilities and nursing homes done at vaccinating their residents and staff?
Well, I would have liked to have seen it done a lot earlier. So when we started, we meaning, the CUPHD and our community partners, when we started vaccinating healthcare workers and then moved on to 75 plus, we wanted the long-term cares to be finished by then. I think what happened, honestly, is that the pharmacies found out that it is a more difficult task, maybe, and it takes more people than they realized at the beginning. So I have been, we've offered to go in and assist places, but right now, we're into February, and everybody, I have been assured multiple times that everyone will be vaccinated by February 12th. So when we offered a couple weeks ago or last week or whenever it was to go in and help, get the vaccine in there, it was going to be a problem for a lot of the places because they had already had all the consent forms ready for the pharmacy to do it. So, we stand by ready to assist if needed, but by February 12th, they're all supposed to be vaccinated.
And we still, as you mentioned, have under 5% of the community vaccinated. So when you and I are on the same posts in town of people saying, do you know anyone that's booking baby showers, wedding showers, and things like that? It's still not safe to be inside in public places.
No.
With, they're saying 50, I believe, is the phase we're in, but even 10 people isn't safe if you don't live with them, correct?
Well, if you don't have masks on, I mean, if you can be in a room with 50 people, but it's in such a way where you can be spread out at least 6 feet and you're all wearing masks, that's one thing. That can certainly be done safely. It's done in workplaces, including here, all the time. But if you can't, if you're eating and drinking and talking and doing things like that without a mask, then there's going to be a problem. And if one person's infected in there, you're likely to have quite a few infected.
It bears repeating before I let you go. Could you go over one more time if somebody 65 or older has had the first shot and how people can sign up or call and get that second shot on the calendar?
Yep. So this is only for people who are 75 and older who got their vaccine at the iHotel on January 12th, 13th, or 14th. They can call CUPHD, and it'll be the same place. You'll be going back to the iHotel, but you need to have an appointment. And remember, we do the appointments so that there's not crowding. So if you did get your vaccine at the iHotel January 12th, 13th, or 14th, you can call 531-4538 and we'll get you scheduled in for an appointment.
And anyone else, so 65 and up, and any of the teachers now, yep. Your office reaches out and lets people know when it's time, or is that up? The onus is on us to follow when is our 3-week versus 28 days?
Well, when you get vaccinated, you'll get a card, and on the card it says what type of vaccine you got. So Moderna or Pfizer, and then if we get other ones, that'll be on there. And then it also gives you a return date. You can't get vaccinated much before that return date, but you can get vaccinated after it. So about a week or so before you're due for your next shot, we will reach out to you through whatever you gave us. So some people give us email, some people give us phone numbers. So whichever way you give us, we prefer email, but we will reach out to you, and then we'll get that. We'll either reach out to you in email with a link that you can click on and schedule, or the phone number so that we can just make the phone call, make the phone call to you and get you scheduled.
Thank you so much. I want to thank, of course, Urbana Mayor Diane Marlin. She is our partner in this, and we are so grateful for her leadership in the community. I also want to thank Jason Liggett, our producer, who week after week is in this with us together. Julie Pryde, you, everyone who works for you, I can't imagine what the logistics of coordinating and scheduling all this, but we thank you all.
I can't imagine either. I'm glad I'm not doing it because it's got to be really hard. Well, and thank you, Elizabeth. You always thank everyone, and I've never bothered to turn around and thank you for starting to do these from day one and continuing to do them, even though I know you have other things to do. And by the way, while you were doing this, your dog has been replaced by your cat on the blanket.
That's what happens. I mean, life has to go on even during a pandemic,
It
correct?
keeps going.
Thank you so much, Julie Pryde. See you,
Thank
PhD. Thank you for everything you do.